Assalamu alaikum, everyone. Peace and blessings be upon you all. Welcome to our webinar. My name is Noor Al-Huda Al-Hashim. I am the director of the Health Literacy Program at the Noor Islamic Cultural Center. I am honored to moderate our webinar this evening and host our speakers. This evening's topic will touch on the current news around COVID-19 guidelines and vaccinations. But most importantly, we will together navigate the perception of American Muslims towards the evolving pandemic. American Muslims consist of diverse demographic groups, each with unique experiences and needs. However, our existence and interactions within the healthcare system are often defined solely by our Muslim identity. So our speakers tonight will share their expertise and provide us with guidance and tools to best navigate the information and crucial decisions that we are making during these times. I'm excited to introduce Dr. Maryam Hussein, Vice President of Imana and Hematology Oncology Fellow at The Ohio State University. We also have Rana Al-Kazzar, a fourth-year medical student at The Ohio State University. And we have Dr. Ayaz Haider, an assistant professor at The Ohio State University College of Public Health. We will do our best to dedicate the last 15 minutes of this hour for your questions and comments. So please, for those who are attending on Zoom, feel free to share those in the Q&A box. And please refrain from sending any personalized cases or private information in the chat. Now, without further ado, I will introduce the first of our speakers tonight. We'll be starting with Dr. Maryam Hussein, who is an Hematology Oncology Fellow at The Ohio State University James Comprehensive Cancer Center. She graduated from The Ohio State University College of Medicine and completed a residency in internal medicine. As Vice President of the national nonprofit IMANA, Islamic Medical Association of North America, she has been working on public health education and domestic projects related to food insecurity, women's health, reproductive health, and climate change. She has also traveled to Haiti as part of Imana Medical Relief to help provide primary care at a rural clinic and raised money to build wells for clean water access. Imana is a leading resource and network for American Muslim physicians and other healthcare professionals in North America. Dr. Hussein has been working on community service projects in the Columbus area and abroad for the past 12 years. She's also the founder of Science Jama, an initiative to present and discuss the rich tradition of science and faith in Islam. Thank you so much, Dr. Hussein, for joining us. We're delighted to have you, and the mic is yours.
Excellent. Thank you so much, Noor, for that very sweet introduction. Can you hear me okay? See me okay? Okay. All right. Assalamu alaikum, everyone. I just want to say a big thank you to Noor, Dr. El-Assad, the Noor Education team for this very kind invitation. I'm very privileged to be here with you all. So, A'udhu billahi minash shaitanir rajeem, bismillahir rahmanir rahim. So the focus today, as Noor had mentioned, is information overload, mistrust, and health equity. So my purpose today is to talk a little bit about mistrust and a little bit more about COVID-19. So why is there mistrust in science? On the other hand, why is there mistrust in God sometimes, where people either believe one or the other? Why do people believe in conspiracy theories when there are facts right next to them? So I'd like to take a step back and look at a current model of thinking and where it came from. So what do we currently believe when we think about the Earth and when you see the Earth? When I see it, I see a world that is a sphere, not flat, that is one of many planets that orbits the sun, which is in a distant reaches of a spiral galaxy called the Milky Way galaxy, a galaxy that is one of many galaxies in a wide, wide universe. However, as a species, as a human species, we didn't always think that. So roughly before the 300 BC range, people used to think that the land they were physically standing on was the world. So before explorers and conquerors went out on ships over the oceans and over lands, people used to think that their land was the only land, that the Earth is flat, that there are no other planets, and that there are just spots up in the sky maybe, and et cetera, and et cetera. It wasn't until the 1600s, roughly, that it was universally accepted that the Earth is not the center of the universe. So just 400 years ago. And that we actually revolve around the sun, another object. Muslims contributed so much to astronomy during the golden age of Islam. Prior to this, when I talk about universal acceptance, just how everyone, no matter what religion, race, or creed, believed in it. It wasn't until the 1920s, so only 100 years ago, that Hubble, the telescope that's out orbiting the planet right now, found more galaxies like ours in the universe. So this timeline is just to help prove that our understanding is ever changing as humans. And as we observe the world with different tools that we're able to figure out, and as we achieve higher levels of understanding. So maybe it's this reason, that this ever-changing understanding using science, that there are reasons for mistrust. So for example, if you look at the top right there, so we know that humans are flawed. One reasoning is that, okay, humans are flawed. They can never be right about reality. Even if science needs time to catch up, which it has over time and proven some things, humans can never be right. Or we go the other end and say that only prayer, only God can save us, and that we don't need science, or we don't need to wear masks, or we don't need vaccines. Another thing is that our ego comes into play, and we say that we know that what is right. I know what is right, and I know what to do because I say that it is. And that this completely takes science, God out of the equation. And then you have reasons that are unfortunately very tragic and due to our unfortunate one aspect of our nature as humans, to hurt one another. Science, unfortunately, was used to do horrible experimentation to the Jews in Nazi Germany and in concentration camps, and also to Black men who were intentionally given syphilis for over more than 40 years just to do an experiment. And this was done as recently as the 1970s, so not that long ago. But what I would offer to you all is that maybe fear is the main reason why we mistrust. Fear of the unknown, fear of a reality that we know maybe to be true, but we don't want to be true. And I'm sure you've come across that at some point as well too. So this author of this book, Dr. Marcelo Gleiser, he's wrote this book, The Island of Knowledge. He's an astrophysicist and a Nobel Peace Prize winner. And he wrote in his book, for those who may just be listening in, how we try to make sense of the world and of our place in it. It should be obvious that our approach is fundamentally limited in scope. This realization should open doors, not close them, since it makes the search for knowledge an open-ended pursuit, an endless romance with the unknown. So I would offer that this romance or a relationship, I believe, should be with our Creator. So as Muslims, we're vice regents, Khalifa, on this planet, and we have a sacred covenant, an imana with the Creator to travel through the earth and deeply observe how God did originate the creation. Then God produces the next creation. Surely God has power over all things. So we are a people, as Muslims, that have used science and faith to discover many modern phenomena, going back to the Golden Age and before. The Quran discusses many of these scientific phenomena that I discussed earlier about orbits. It discussed the universe, the vastness of the universe, how a fetus develops, and for what period of time it develops in the mother. Even the production of fire from wood, this is in the Quran. So as Muslims, I believe that we don't believe in conspiracy theories, but we discover theories. So how has that been proven? So through revelation and scientific insights, we can see that wudu actually promotes hand washing 5 times a day at minimum. That the concept of modern day hospitals that we know of today actually started in the Muslim world, a modern day hospital system. That Muslims help contribute to the understanding of optics and physics, especially for those who have glasses will appreciate this, like me. That we contributed to chemistry and pharmacology by refining the process of distillation to make future medications, medications that many of us take on a daily basis. So using science and faith are foundational to us as Muslims. And you can find more of this information on 1001 Inventions and also the Nagamiya Institute for Islamic Medicine and Sciences, if you want to know more information. So what does this mean for our current pandemic crisis, which we are in, unfortunately? Yes, we do not have enough information. That is absolutely true about this virus because we are in the beginning of it. We've had 11 months, now probably almost 12, 10 to 11 months of data, when we have 103 years of data for influenza when the flu pandemic happened in 1918. We just don't have enough time yet to give all the answers. But what do we know? Especially just in these last 10 to 11 months? That unfortunately there is a variable picture. Some people get the virus and it's as if they have nothing. Some people unfortunately become very, very ill, end up in the hospital, in the ICU, intubated, struggling just to survive. We also know that there's a difference between people who will be susceptible to the virus if you're healthy versus, so healthy meaning not just you may be thin or you might eat well, but your body, your actual immune system structure and how you choose to eat and how you choose to exercise and your fat to muscle ratio and your lean muscle mass ratio, all of that contributes to your health versus people who might be immunocompromised, who are either going through, let's say, cancer treatment, or who have an autoimmune disorder and need to suppress their immune system. What we do know very strongly is that this virus is spread asymptomatically, meaning you don't have symptoms, but you could have the virus and it's not causing a problem to you, but you can spread it to someone else. So that's why masks are so vitally important, because this thing can be spread through droplets in the mouth, whether by coughing, sneezing, even talking or yelling loudly. Hand washing. Hand washing is another extremely important way to help prevent the spread of a lot of these viruses and bacteria. And social distancing, not, never seeing anyone, but staying 6 feet apart, since they've studied that this virus can at least spread around a radius of about 6 feet. We also know that the healthcare system has been stretched very, very thin. I was covering the inpatient services about 2 weeks ago, and there's a machine called a BiPAP, which can help people breathe instead of using a ventilator. And we didn't have any more in the hospital that night because too many people were using it, not just for COVID, but because a lot of people just need that machine. So it's not just that there are a lot of sick people with COVID, that there are people who are just sick because people get sick and they need a hospital, they need a healthcare system. And that is being stretched very, very thin, especially in different parts of the country. In addition, we also know about the mRNA vaccine. So I know that there's a lot of stuff about that, and I won't get too much into it in this particular time I'm talking, but this technology has been there since the 1990s. So yes, this is the first mRNA vaccine that we've seen, but the science and technology has been there before. So there's still so much out there for us to learn and to understand, and we'll never understand it fully, right? And all that's in the hands of Allah. But if we do keep the faith and we in His knowledge that He's given us, and also the knowledge that He has, and if we have faith in Him, we can learn so many more answers. And my colleagues are going to be discussing some of this now as well. And I just want to leave you all with this quote as well. So Jazakallah khair for the opportunity, and I'll hand it over back to Noor.
Thank you so much, Dr. Hussein, for sharing your time and expertise with us. All amazing points. And for anyone who has questions for Dr. Hussein specifically, feel free to send them in the Q&A box and we'll be able to address them towards the end of our talk. Moving on to our next speaker, we have Rana Al-Ghazar. She is a fourth-year medical student at The Ohio State University College of Medicine. She comes to Columbus from Tennessee, where she attended college at East Tennessee State University to study microbiology and mathematics. She's pursuing a career in academic internal medicine with a special interest in health equity. She's also involved with the Gold Humanism Honor Society at OSU and nationally to advance compassion in healthcare. She also previously served 2 terms as president of the Muslim Professional Student Association. Rana, we are always so happy to have you with us, and the mic is yours.
Thank you so much, Noor. Assalamu alaikum, everyone. Such a pleasure to join this conversation. I'll go ahead and share my slides here. All right. Can everybody see my screen?
Yes.
Okay, great. Thank you. All right. So I am going to transition from what Dr. Hussein talked about, this bridge between science and religion. I think that often in the religious context, especially across multiple religions, not just Islam, some people have the notion that science and faith are in conflict somehow. But I remember when I was in college, I had a professor who, was himself a devout Christian, but he was also a doctor. And he would say that it was his opinion that those who believe science and religion don't go together, either didn't understand science or didn't understand God. And it just stuck with me because I do think that often that bridge is not clear to people, but really as someone who is in the medical field, I find science to be really a window into Allah's creation and his hikmah. And increasingly, what I'm really interested in as a future physician is how people play into science and into health specifically. And so that's what I'd like to spend some time talking about today, is moving from the science, the technicalities, to really how it affects us on a day-to-day level and how it affects our health. And really what ties all of that together is people and within our communities and how each of us functions within our community. So that's where I think the conversation of health equity is becoming increasingly important. And so we've seen how with COVID-19, what it's uncovered is that not all people have the same potential to attain full health, that because of somebody's race or religion or other factors, people are disadvantaged when it comes to being and remaining healthy. And with COVID-19, we found that particularly Black Americans, immigrants, refugees, that there were a lot of minority populations who were made vulnerable in the time of COVID-19. And despite making up a smaller percentage of the total population, accounted for such a large number of COVID cases and COVID deaths. And so that's what health disparities, that's essentially what a health disparity is. It's the fact that many minorities within the US and across our cities have been disproportionately affected by problems like COVID-19, in addition to a lot of health problems. And so in order to understand why those inequities exist, and why not all people have the opportunity to attain full health, we have to understand the social determinants of health. And so the social determinants of health are defined by the World Health Organization as the condition in which people are born, grow, live, work, and age. And these circumstances are shaped by the distribution of money, power, resources at global, national, and local levels. And what I've highlighted there specifically, the fact that these determinants are shaped by money, power, and resources is really critical, because at least in this country, money, power, and resources is often determined by issues like racism, the fact that not all Americans have equal access to wealth and education, and that there are really root causes to those inequities. And that's where racism, bias, and discrimination at multiple levels has a huge impact on health. And so within the healthcare community, and as a medical student, this is becoming a bigger part of the dialogue when we talk about how we help people become and stay healthier, that we can't ignore these social determinants. And in fact, when we think about the social determinants, like some of the components I've mentioned, education, neighborhood, the environments where people live, economic stability, wealth, all of these factors play into somebody's health and their well-being. And in fact, only 20% of our health is determined by direct health care and the care that you might receive at the doctor's office or the medicines that you might take. And that the remainder of the social determinants actually accounts for whether or not somebody is healthy. And so increasingly, in healthcare, we are trying to find better ways to tackle some of these other areas. Traditionally, those of us in science, those of us in medicine, really just thought about the medicines, the things that, we use to treat disease. But what we found was that that was not effective, that there were a lot of people that we were not helping, whose health we were not improving because we were missing all of these other parts of the equation. And so how do we intervene on these other levels that seem pretty large, right? Education and income inequality. These are some big topics, but what we found and what is happening here locally is that academic institutions like Ohio State and hospitals and corporations are finding ways to connect with the community. And community means a lot of things. It means our religious institutions like Noor, it means our schools, and really finding ways to connect directly so that we can talk about nutrition, that we can talk about housing, because we know that all of those factors impact people's health. And so what's pictured here on the slide is just one example of such a partnership where the Ohio State Wexner Medical Center partnered and actually went directly to communities in Columbus that were hit hardest by COVID-19 and delivered community care kits that contained hand sanitizers and masks. This was earlier in the pandemic over the summer. And I share this one because a lot of the people involved were my research mentors, people who have taught me about how we improve in our connections between healthcare institutions and community organizations, but also to show you that it's possible, it's doable. And I think that this is where we are going when we talk about improving health. This is the direction that many of us are taking, especially as it relates to our minority communities that are often hit hardest by pandemics, but also who have highest rates of chronic disease and other risk factors. And this is just a schematic to explain a little bit further about what it means for healthcare institutions to partner with their community, to partner with their government. And I just want to draw your attention mostly to the diagram on the left. And that is, I think often we think about these different sectors individually, and those of us maybe who work in medicine, we're only thinking about the medicine and we work within our own bubbles. But like I mentioned, we really miss a lot of other factors. And so what we have to do is find ways to actually connect. And so for community members to come together with their local government leaders like mayors, their legislatures, the national government, but also partnering with universities. And when we talk about partnerships, it's about bringing together ideas, it's about bringing together resources, and importantly, bringing together funding, because that's how things get done. And specifically, when we talk about the community, that this is where religious institutions are really important. This is where we come in. This is where organizations like Noor come in, where we have an opportunity to interact with other sectors of our community that might be doing very different work, but that share our commitment to helping members of our community be safe and stay healthy. And so I'm talking a lot about collaborations. I'm talking a lot about how different parts of our society come together and work together. And it sounds very big and macro, but what I'd offer is that there is something that binds all of this together and makes this kind of work possible. And so the question I've posed here is, what's the secret sauce? And in my work and research with community engaged research and community engaged work and service is that it all comes down to relationships. This is where it starts and ends. And this is where all of us, no matter, which area we work in, whether we're learners or whether we're professionals, this is where all of us can have an impact. And so what we find, and as we've continued to discuss with COVID-19, that a lot of people have problems with trust. And often we are blaming individuals who are mistrustful. But what we have to do is look within ourselves and ask why people don't trust us. And when I say us, maybe that means our medical institutions. And we can't ignore that personal relationships do make a difference. I think whenever you're talking about collaborating and working together with different partners and institutions, that those individual interactions do make a difference. And being kind makes a difference. Being liked makes a difference. When we are talking about influencing thought and behavior, we can't underestimate how important relationships are. And even when you look at some of the biggest collaborations out there and some of the biggest partnerships between government agencies and nonprofits and universities, often those collaborations started with two people that came together, that knew each other, that valued their shared goals and visions and said, hey, let's work together. And so again, those one-on-one interactions, those one-on-one relationships within our families, within our social circles, and within our work environments are very valuable when we're doing this kind of work. And I'd also offer that I think, you know, as we look to make changes in our community that seem very challenging, like tackling race and health injustice, you know, we have to look within, meaning within our own families, and evaluate the relationships within those who are closest to us. Because I think, once again, that's where a lot of us can have impact. And you have to be present if we're asking people to make changes, but we don't know what they value or what their culture is, what's important to them, we don't get very far. And so again, taking the time to invest in the communities and in the people that for whom we want to improve outcomes, we really have to look at those relationships. And what I've pictured here are just some things that have happened here locally in pre-COVID times, as you can tell. During medical school, I got to participate in community health education, and we worked with the Focused Learning Academy here in Columbus, and we taught health education courses, myself and some other medical students. And, you know, pictured here is an interfaith circle with, you know, members of NOOR coming together with other faith leaders and members from other religious groups trying to understand one another better. And this picture here is of shout out to the Muslim Student Association's annual charity banquet. This is from 2019 when we were discussing criminal justice reform. And so these are all examples of ways that each of us can step outside of our immediate bubbles. And so for myself, that means stepping outside of the medical bubble and interacting with students within schools and those in our government and legal system. And then within our religious institution, being able to communicate with those of other religions and other cultures. Because I think ultimately, as we look to partner to tackle some of these big problems in our society, that those individual relationships are absolutely key. And I think that that is it on my part. I'd like to give the floor now to Dr. Haydar to tell us a little bit more about how COVID-19 relates to our efforts in the community and take this conversation further.
Thank you so much, Rana, for your wonderful presentation. We deeply value your perspective and your experience in humanism and community work, and we hope that we keep you around during your residency, inshallah. Without further ado, we will introduce our third and final speaker for today, Dr. Ayaz Haydar. Dr. Haydar is an assistant professor in the College of Public Health and affiliated faculty in translational data analytics at the Ohio State University. He received his PhD in biology at McGill University and completed postdoctoral training at Yale University and University of Toronto. He connects models to action for public health impact and helps communities develop models that reflect their values. This means placing communities at the center of the modeling enterprise. The focal public health issues that he addresses are birth and infant outcomes, addiction, and food insecurity. Common to these outcomes is the role of social determinants of health, the need for multiple stakeholder engagement, and breaking down discipline and data silos to come up with holistic and sustainable interventions. A novel theme of his research is developing strategies for community-centered modeling, where models are co-created, personalized, and relevant to community needs, and generalizable to other communities. Dr. Haider, we are very privileged to have you with us, and we're very grateful that you're sharing your time and expertise. Thank you so much, and the mic is yours.
Jazakallah khair for everything. Thank you for the organizers to invite me to this talk and share them with other really amazing speakers. Bismillah ar-Rahman ar-Rahim. As-salatu was-salam ala Rasulullah sallallahu alayhi wa alihi wa sahbihi wa sallam. Today, I would like to help the viewers answer 3 questions. So the first question that I'm hoping I can help answer is about who is telling the truth about COVID-19 and vaccines. I'd like to begin by asking, if anybody knows who Kamran Khan is. Who is Kamran Khan? It's not, if you try to search it, you see a lot of hits about Imran Khan, but that's not what I'm talking about here. So Kamran Khan is the senior author on a publication that appeared in January 2020. And his group at Blue Dot was one of the first that alerted the world to the novel coronavirus and its potential spread to be a pandemic from China. Dr. Kamran Khan is a physician and a public health scientist at the University of Toronto, and he is also Muslim. The sources of data and information in public health come from multiple sources. I've listed a couple of them here, and the reason that I would like to walk us through how information is gathered in public health, which really does try to address that other 80% of the factors of the issues that Rana mentioned, that the 20% is inside the clinic in the healthcare system, and then 80% of what happens is outside. So that's what public health is trying to do, really. And so the sources of data that we often have are disease reporting systems, where we can pick up some anomalous behavior when certain diseases are about to explode or have an outbreak, for example. We can also use data or information from community and case reports. And then a lot of that information is sometimes then gathered and collected in what are called peer-reviewed articles. So these are scientific articles, like the example that I show on the screen here, where experts have looked at that material. They have judged it to be scientifically sound, methodologically sound, and then it is put out into the literature for other people to know. And what is done with that information is often an assessment by public health agencies about whether we need to take actions or not. And the reason that is so important is because in public health, we are affecting the decisions that are made. The actions of public health agencies are affecting the lives of populations, of whole neighborhoods, of whole cities, of whole countries, of the entire world. And so there is a transparent and rigorous assessment of information before responses are taken. And some of those responses and actions are either targeted towards individuals, for example, to contain an outbreak of something or to address a certain environmental exposure, but it can also affect populations. And the reason that it is important to understand the difference between that and what might happen when you visit your doctor is that what the doctor says is really just going to affect you primarily. But in public health, the actions are affecting populations at a very large scale. And so it's very critical that we know what the sources of information are and how that passes through the rest of how public health decision-making is done. Here's a quick example of what that looks like. So there's information that is gathered, it is assessed, there's an action taken, and there's a response. And as new information comes up, it is assessed again, then there are actions and response taken. Now, let's take the example of, in our deen, let's take an example of someone who you might be praying next to. So you see them maybe do something with their hands or some some motion during their prayer, and you think, oh, what did I just see? Oh, okay, this person did something new that I haven't seen someone do during prayer. Now, when you look at that information and you don't ask an imam, or you don't ask Imam Abdul Munam at NICC, or you don't ask a knowledgeable person about what that action meant, is this something that is a difference of opinion in our deen or not, then what happens is that there is a limited assessment, and that assessment is really being done by non-experts. And then there can be unintended individual consequences where you may repeat that action in your own prayer, right? And when you do that, what can happen is that you can potentially have unintended consequences at a larger level, because maybe someone else sees you do that and then they start following that. And so then the question becomes, was your prayer valid or was their prayer valid? And so in the same way, when we have new pieces of information enter the public health field, and there's no or limited assessment of that done by experts, there are unintended consequences at the individual level that can be amplified at the population level. And so it's really important to understand how information is gathered, how it is assessed, how it is acted upon, and why that is so important that we consider that information and we consult with others before we spread that information. And consideration and consultation are very important characteristics of a believer, and they are from our deen. These two ideals are from our deen. The second question that I would like to help all of you try to maybe answer from a public health perspective is why everyone may not get the vaccine. And this builds on some of the comments that Rana made about equity. So let's think about why everyone may not get the vaccine. Well, right now, as you all know, there's a limited supply and there are delays in the supply chain for vaccines. There are concerns about how quickly vaccines were developed and their side effects. So vaccine hesitancy is prevalent in many communities. There's also a lack of trust, as Rana mentioned, based on historical abuses, and there is systematic discrimination based on social economic status. Now, another reason that I'm going to talk a little bit more about is this lack of access to approved vaccine providers. And I want you to think about accessibility in a number of multiple dimensions. So accessibility is not just how close is this vaccine provider to me. Accessibility for some in our Muslim community means overcoming limited English proficiency, and how that manifests is not being able to read the material or understand the information that is being shared because it is not available in languages or plain English or in translation that gives us the answers that we need to make us comfortable in knowing that it is safe for us to get that vaccine. Also, there might be limited time slots for appointments where we might end up not being able to take time off from work and be able to get that appointment. There's also lack of health insurance or uncertain legal status or immigrant status of individuals, where they might be worried about how the information that is gathered from them during the vaccination process might be misused. And that's been going on for the last 4 years. There's lack of transportation issues where the current approved sites are really far away and it really is expensive for us to go there. It might be difficult for those who are working multiple jobs to take time off from work, and eligibility right now is based on chronic conditions in phase 1B, age, and for school staff. And so when it's not your turn and there's this anxiety to get the vaccine, that also is an access issue. And also there's the difficult process of often navigating the registration process. So you may not be able to understand the website or the registration process, or misinterpret the form, and there might be an issue with that form. So when you get there, you're not able to get the vaccine. So accessibility in public health is addressing all of these issues and more in order to get people vaccinated. And so the reason why everyone may not get the vaccine is because these issues disproportionately affect certain populations than others. And because of that, there needs to be more work done to address those barriers. The last question that I will try to answer for you is, why should, maybe you're thinking, why should I get vaccinated when others may not? So as you know, in the US, it's not something that is mandatory. It's not required that you get vaccines. So, but you might be wondering, what is the benefit to me or to others to get vaccinated when my neighbor or my other people in my family may not be getting vaccinated? And I'd like to explain that by giving a simple example of how we evaluate individual risk versus community risk. And so this animation on the right side talks about time in terms of how much time you're spending with individuals, space, whether you are physically distant from other people or not, the people, whether they have chronic conditions or not, that might place them at a higher risk for COVID-19, morbidity and mortality, and the place, whether you're indoor and outdoors. So when you look at yourself and you say, considering the time, space, people, and place, my individual risk is probably not very high of getting exposed to COVID-19. Okay, but what about the community risk? So if you don't get exposed, but what if the person who you live with, or the person who you work with, or the person who you might come into contact with unknowingly, they get infected? Their individual risk may not be the same. They may have those chronic conditions. They may have some of these other things that might increase their risk of ending up in the hospital. And so when we look at risk, we need to think about not just ourselves, but how our actions affect other individuals. Second, getting back to normal is something we all desperately want to do. We all want to enjoy that time that we miss of being with our friends, with our family members during Ramadan, during Taraweeh, and celebrating that Eid. And depending on how quickly the vaccine supply picks up, I don't know what Ramadan and Taraweeh and Eid will look like this year, but inshallah, for those who get the vaccine, there could be something where they could be allowed in the mosque. I don't know, but this is something to consider as we're trying to get back to normal. Family and friends, we all want to see our family and friends, hug our parents who we may not have been able to visit, who are abroad. Schools are sometimes closed, sometimes open, and that creates a lot of disruptions for many families. We have curfews where some of your businesses may be affected. And lastly, and this is a really important point, is the mental health and well-being, especially of our youth and our elderly. This cannot be stressed enough, because as human beings, we are a social animal and we are not meant to live in isolation. That's just not how Allah subhanahu wa ta'ala created us. We are meant to be in this world, to be of this world, but not in this world. And that means that we are supposed to interact with people. And unfortunately, the sad reality is that the mental health and well-being of our youth and of our elderly is being, it's not being seen, because these are often voices who do not have the power to be seen, and it is causing a lot more harm. And it's because we have not been able to reduce transmission, and we have not been able to get this epidemic under control. And inshallah, that will happen with the new administration. And then the last thing very quickly I'll talk about is herd immunity, how the actions of one individual affect other. So in this diagram, when no one gets vaccinated, the disease can spread quite easily. And many people can get infected, and some of those will end up in hospital, and some of those may end up dying. But when some people get vaccinated, we see that the disease can spread. It can still spread, but it spreads a little bit lower, and that reduces the chances of people ending up in hospitals. But when most people get vaccinated, what we end up seeing is that the disease has a much harder time to spread. And so that's why herd immunity is really important, because your actions are going to affect the lives of others around you. And in the interest of time, I'm going to skip over this, and I believe these slides are available. But what I would like to bring up is this idea from our deen, how the actions of a few can adversely affect the larger outcome for the community. And so this is the hadith about the people who were at the bottom section of the boat, who were trying to get access to water because people at the top were preventing them. And so they said, okay, well, there's water underneath us, so let's just dig and create a hole in the boat. But then the people at the top realized that, if they prevent this person from doing that, from digging that hole, they will save the person at the bottom and themselves. But if they leave the person at the bottom to do whatever they want, right, to not listen to public health guidance, to spread misinformation, whatever, then they will destroy him and themselves. And so it's a reminder that our actions have consequences, and we need to consider what we're doing. I want to leave all of you with 3 specific actions that you can take today. First, consider and consult before sharing information on social media. Second, help those with less access to COVID-19 vaccines. Third, get vaccinated to get back to normal. I know we're tired. I know we're sick and tired of this pandemic, but this, inshallah, will pass. And please, if you have questions about vaccines, then let's make sure that you get them answered. I would like to also point your attention to a specific materials that are going to be available, and some material is already there on this link from Care Ohio, which is being put together in collaboration with an employee resource group at the Wexner Medical Center. And so vaccine education materials some of them will be available starting next week, but that information is out there. So please make sure that you do your due diligence, consider and consult before sharing information, help those with less access to vaccines to get access to vaccine, and get vaccinated to get back to normal. Jazakallah khair for your time, and inshallah, look forward to your questions.
Dr. Haider, thank you so much for a wonderful presentation. I think personally, I can say you've addressed a lot of the questions that we have as individuals and as a community. I think you answered a lot of the points that are circling around and are really creating most of the concern that we're having as a community here. I also wanted to remind everyone that the resources Dr. Haider was referring to will be shared across our platforms, and you can always reach out to us if you have additional questions. I also wanted to specifically thank Dr. Haider for his efforts in the NICC community, leading the COVID-19 task force and making sure that our masjid and our community is staying safe and is following the correct guidelines throughout this entire pandemic. So thank you so much for that. And he's continuing to lead a lot of the efforts, especially now in terms of vaccination. So we will continue to share the resources that he shares with us, and we are open to all of your questions and concerns throughout this time. All of you have done a wonderful job introducing this topic and these questions to our community. I really appreciate the flow of the information that we've had throughout this webinar. And this leads us finally to our Q&A. We have received a few questions throughout the webinar here, and we will begin by addressing them. I believe one of the first questions we had was addressed to Dr. Hussein while she was speaking. I saw that you've answered it on the webinar, but for the sake of having this information shared long-term with everyone, I will read the question again, and if you don't mind summarizing your answer to that. So this question reads, you mentioned mistrust can be the mask for underlying fear. Ignorance is one reason for fear, but what about trauma? How do you see Muslim communities develop post-traumatic growth?
Yeah, no, thank you. Again, thank you for the, organizing this webinar and for the questions. So I admittedly, would say that I don't know if I have all the answers or the right answers per se, but again, just something that I would offer is that trauma can be used as a way to lead to growth, and that it comes back to the thing where, unfortunately, you cannot always see what is good unless you're dealt with something bad, right? And then you see the good that's around it. And the Quran also says it very well too, right? Verily, with every difficulty, there is relief. So even though we're going through such tragic events with COVID, and it's been absolutely devastating, that there is going to be relief afterwards. There, inshallah, there will be. And it's just a matter of when we look back, and when we looking back at what we've been through in order to look forward as to what do we need to do, we can see all the gaps that Rana and Dr. Haider so eloquently portrayed out is that the gaps in our healthcare system, health equity, health access, racial inequity. One thing that's close to my heart is climate change and how, these pandemics are being more of a reality because of what we're doing to the planet. So as much, as we go through these trials and these difficulties, there is growth in the sense if we are able to look back and see what we've been through and how we need to improve. And that growth can then lead us to fix the problems that led to the trauma in the first place. So then inshallah, the cycle doesn't continue.
Absolutely. Thank you so much for sharing your input on that. Another question we received was during Rena's presentation. It addresses social determinants of health that you touched on. The question reads, speaking of social determinants, do you feel Muslims are at more disadvantage since they are radicalized yet can't rectify this since their religious affiliation is not a visible variable in the determinants of health? And if you agree, how do you suggest remedying this?
Assalamu alaikum again. Yeah, so that's a great question. So the question mentions here how Muslims are racialized yet can't rectify this, perhaps because some of those aspects may not be openly visible. So I think that, at least within the circles in which I work, representation is becoming increasingly crucial to this work. And what that means is when we're, working, let's say at the university level, that when we're creating groups to try to tackle certain problems, that to make sure we do have Muslims at the table. If we're trying to address issues within the Muslim community, there has to be representatives from that community. All of us, as much as we try to understand other cultures and other religions, it's really the people within those communities that know their communities best. And so we really have to capitalize on that and ensure that within our efforts, we have good representation. I think our institutions are moving closer to that. Historically, that's been a major challenge. When you look at our leadership, individuals who make the big decisions, often they're not minority groups within those circles making decisions that impact their community. And so I think a step in future directions has to include greater emphasis on representation at all levels. And when we're working in the community too, what I am seeing more of, and this is encouraging to me, is that we're walking away from this attitude of, let's say in medicine, like, I know what's good for you, here's the solution. And more so moving towards, this is what I know, but I want to hear from you, and going to communities as we are designing solutions instead of showing up after we've made plans and say, here you go, because often we don't know what communities need. We think we do, but we're often wrong. And so we have to include members of the community. We have to engage early on, listen to what people actually want to prioritize, because that might be different than what we envision. And so I think for those of us who are involved in efforts like this and want to help our communities grow and become stronger, we have to have representation where it matters, and we have to include everybody in the conversation as we're coming up with solutions.
That is a great reminder, Dana. Thank you for that. And I would use this opportunity to remind those listening, no matter what part of the community they are in, that we are open to your questions. We want to know what your concerns are, because the professionals are here. They want to share their expertise. They want to share the resources that they have access to, but we want to know how to best reach you. So we are open. We are trying to, get this work across, get these resources across for everyone. So, this platform is one of many that is trying to get your voices heard and get the information across. So always feel free to reach out to us, and we can connect you with wonderful local professionals like the speakers we have today. We have two more questions that we can address here. Feel free for anyone who has input on the questions as to pitch in. The next question reads, in your opinion, how can Muslims initiate a conversation given the context of their historical trauma of being marginalized, especially given that a pandemic may not resolve with one community sect disengaged from the solution? If any of you have things to share regards to that question.
One thing to realize is that in North America, the Muslim community is not homogeneous. So when we talk about the historical trauma and what marginalization looked like, what it felt like for different communities is very different. For African American Muslims who have been here for, over 400 years, um, they have faced different traumas than the early immigrant communities that came in the 50s, the 40s, and then the follow-on communities that came from immigrant and refugee backgrounds during the 80s, 90s, and the early 2000s. And then you have second generation and third generation Muslims from each of those communities. And so what, how do you initiate that conversation is going to look very different given the social, economic, and that historical status of each of those communities. And unfortunately, we live currently in situations where we have mosques that have certain social, economic, and ethnic and demographic um, labels that this is the Pakistani mosque, this is the Arab mosque, this is the African American mosque, and that will eventually go away if we work together. And then they have their own different barriers to trust. So I think that there isn't going to be one solution. It's going to look different. And like Rana said, you have to engage with each of those communities on their own terms, and see what they need and meet them where they are.
Thank you so much for sharing that. And relating to something you mentioned in your presentation as well, one of the barriers to, for example, getting vaccinated is limited English proficiency. So this question touches on that a little bit, asking if you feel that health literacy and use of big terms within Muslim communities who are considered younger and heterogeneous, that there are barriers to build trust with the system because of that. If you agree, whose responsibility is it to overcome this barrier?
I think more of us need training in health in communication. Unfortunately, most of us are not trained in how to communicate appropriately, and sometimes we do end up creating more problems and doing more harm than good. So I think it's everybody's responsibility. First of all, it's not one person's, it's everybody. It's the academic training, it's the from the high school all the way up. It's everybody's training to do it. And if we don't do it, then it's going to lead to problems. So if others have thoughts, that would be great.
I'll just add too, I think in addition to challenges with language, which in some settings we can remedy a little bit because we have translation services, let's say at hospitals, but you can't translate culture. And I think that's equally important to language. And that's where we miss a lot of people and a lot of communication goes wrong, is we're not on the same page. We're translating the words, but we're not on the same page. And so I think this again goes to the importance of representation. Is we have to, let's say within our healthcare or public health efforts, have people doing the work who are of that culture, can speak the language as well, because often those are the individuals who will have the most impact. And so investing in them and supporting them in doing that work, I think is really important.
One thing that I'll maybe just add is that when they had mentioned, that Dr. Heather mentioned that the responsibility is all of ours, is that just being that it's okay to recognize that people are intelligent enough to understand things, and that if they don't understand, it's because there is some miscommunication going on. So not to assume that people cannot have the possibility to understand if they're not an MD or PhD, whatever the case may be. And that it is very important, I think, again, as Muslims, that it is okay to learn science along with your faith, and that to help everyone end up being on the same page about, what is the basics of infectious diseases and washing hands, right? Just the basics of that, which a lot of people don't do. And again, that's more generational, I think, than an inherent intelligence.
Absolutely.
These are great takeaway points from all of you. I really appreciate you sharing your thoughts on this question. That wraps up our Q&A session. This has been a great webinar and a great opportunity to get to know the work that you are doing and the unique needs that our community has. As mentioned earlier, all of the resources that have been mentioned and will become available will be shared across our platforms. If you are not already following us, you can find us at NICC Education, and you can always reach out to us through email on education@nudohio.org. This webinar is currently being live streamed on YouTube, but will also be shared after the live session is over. If you have any questions after that, anything else to share with us, we are happy to hear from you. And please stay on the lookout for new information that is coming out, new guidelines that are coming out. We will continue to share those things with the help of our professional experts like Dr. Hussein, like Rana Kazar, and Dr. Haider. We will continue to be in touch with our community, and we hope to hear from you as well. Again, thank you so much to all of our speakers. We appreciate you immensely. And I hope that you all stay healthy and well. And Assalamu alaikum wa rahmatullahi wa barakatuh.
Assalamu alaikum.